My name is Richard Paul Texada Jr. I'm an orthopedic surgeon. My practice in Slidell, it's a fairly general practice with a little emphasis on sports medicine. We see pediatric patients, the younger population, and all the way to the very older population for pretty much anything they need as far as an orthopedic problem goes. We see some straightforward hand problems, carpal tunnel, trigger finger, fractures of all kinds, lots of knee arthroscopy, shoulder arthroscopy, rotator cuff problems, total hip, total knee replacement, and injuries, again, whether it's a fracture or a ligament tear, ACLs, sprained ankle, pretty much anything. I get a lot of referrals from primary care physicians and other specialists, cardiologists and whatnot. Often people, if you have an orthopedic problem, they recognize it as such. It's not a belly pain that you have to go to your primary care doctor for. It's a sprained ankle, it's a broken arm. You know that you look for an orthopedic surgeon. We can really treat the spectrum of orthopedic problems or musculoskeletal problems. We have a large group of neurologists that can treat that area. The overlap, as it gets to peripheral nerves is something that I would do, whether it's carpal tunnel or other nerve impingements or entrapments. We have spine surgeons and pain physicians that work on the spine and nerve roots. As it gets into more of an orthopedic problem, more of an extremity problem, an arm or a leg, they can recognize it as such and get it to me. And likewise, if it's a spine problem or a pain problem, I can recognize it and refer it to them. We have a very well-orchestrated machine. We communicate well with each other. It's often not just written notes and whatnot. It's on the phone. We call each other, hey, I have somebody that has a problem. It's a lot easier to get them in, get them seen quickly. I think this small hospital is the best of both worlds. It is a hospital, it's not just a surgery center, so we can treat all types of patients. We have overnight stays for our total knees, total hips, and we can keep them here safely with excellent medical management. It's also nice in a sense that it is small, like a surgery center. It's quick in, quick out, not a lot of red tape, not a lot of hustle and bustle of the other medical type of patients that bog down the ER or the hospital floor. We can have your surgery here safely, quickly, and have you on your way. Often as we age, we have damage to our joints, specifically the knee and the hip. There's a wide range of things you can do, from conservative management, pills, shots, injections, activity modification, all the way to different surgeries. Sometimes it's arthroscopy. Often if you're beyond the point where an arthroscopy would help you, you talk about replacement, either unicompartmental, which just means a partial knee replacement, or a total knee replacement, or hip replacement. Different gamut of surgery, so to speak. If you're having a mild degree of pain, well, it hurts after I walk 18 holes of golf, and I take an Advil and it gets better, well, you don't need a knee replacement. I'll tell you, get a cart, play 9 holes, do something different. If you can't walk down to your mailbox and get your mail without limping, or you don't get off the couch and do something that you like to do because your knee's gonna hurt, well, it's time to think about other things. And so if you're having kind of pain on a daily basis, worse with anything and everything you do, it's time to start thinking about something bigger. When your quality of life is significantly adversely affected, to the point where you're not doing the things you enjoy, you're missing out on things that you used to do to a significant degree, you can consider knee replacement. Knee replacement, I tell people, it's a big surgery, but it's a good surgery. If that's what you need, that's what it's going to require to get you kind of back on your feet, literally. It is a significant surgery. We do it quickly, safely, cleanly, and we have excellent results. Hip replacement, similar to knee, meaning when your quality of life is significantly adversely affected to where you can't do the things you like to do. You might not even be able to take care of your day-to-day things you need to do. Go shopping, go to the grocery, mow your lawn. You can undergo hip replacement. Again, hip replacement's a big surgery, but it's a great surgery.